Today, we invite Mr. Maria McKeel, who's the CEO and the Managing Director of the Respiri Limited, to join us for an interview. Respiri Limited is an ASX-listed medical technology company developing devices and mobile health applications to improve the management of the respiratory disorders such as asthma. So, Marianne, thank you for joining us today. Could you please give us an introduction of the Respiri Limited, about its business, technology, and products?
Thanks, Steph. Yes, that'd be my pleasure. We're very lucky to be involved in one of the largest markets that afflict the human race. Asthma is the third most prominent disease state that afflicts the human race. And unfortunately today, once a patient leaves the care of their doctor, they have absolutely nothing available to them to manage and monitor how well their asthma is being controlled. Now, we know this is a problem because even here in Australia, every year in this first world country, 400 people die of asthma, and they shouldn't. 270,000 people end up in hospital, emergency wards, and ICU as a result of asthma attacks. And the asthma exacerbations and attacks cost the Australian economy around about $24 billion a year in hospitalizations, medical interventions, loss in productivity, and absenteeism. We at Respiri have a wonderful technology, a medical device that allows us to capture and monitor how well a patient's asthma is being controlled once they leave the care of their doctor. So we measure wheeze rate, which we basically place the device on our throat for 30 seconds and records breathing, and then our proprietary algorithm analyzes that and gives us a wheeze score, which is pretty exciting because it is one of the lead symptoms in asthma management. We also capture other pieces of information, things like weather, atmosphere, air quality, pollen count, drug usage, and importantly, the asthma management plan that is pulled together by the doctor. Now, all those things are geocoded, so no matter where in the world you are, you'll get the specific details for that part of the world. Now, these things are very important for an asthma patient because they are the things in the real world that lead to exacerbations and asthma attacks. We are the only organization in the world that can measure changes in wheeze and combine all that together with machine learning to provide the patient with information about how well they're being managed, give them alerts as to when things may not be as good as they should be, a forewarning, and importantly, share that real world data in real time with their doctor, their parents, their carers, their teachers, whoever they want to include in their caring team. So that's fundamentally what our technology does.
Thank you for the introduction. Yeah, asthma is, as we know, it's a global health issue. And I know in China, it's probably about like 50 million people have been diagnosed with asthma. I guess there will be more people who haven't been diagnosed yet. And so from the recent announcements, we realized there was a new partnership established with CIPLA and also the Australian Patient Associations. Mm-hmm. Could you please tell us a bit more about how the partnerships goes and how would you expecting they can bring to you, and probably what part of the market they can bring the Respiri to? Mm-hmm. Thank you.
A very good question. We're very excited at the partnerships that we have announced over the last few months. The big partnership, of course, is the partnership with CIPLA Pharmaceuticals, a very large multinational pharmaceutical company that specializes in respiratory medicine. Now, their charter as an organization is basically to create an ecosystem in respiratory health for their patients. So everything from devices through to medications, and the piece that was missing for them is the wheezo. So we also made sure that when we're looking and choosing partners in the pharmaceutical space, that they needed to have a global presence because, you know, we don't kid ourselves at Respiri. We aren't big enough to be able to take on the world by ourselves and win quickly, cheaply, and effectively. So we need to have a bespoke model where we partner with the right people who have those competencies and infrastructure. And CIPLA is our 800-pound gorilla that we work with here in Australia. We've chosen Australia as our launch market because we know this market well. And we have one of the highest levels of asthma in the world. So there's 2.7 million patients with asthma in Australia. And in the globe, about 340 million patients have asthma. So it's a huge market. So we want to get it right with Cipla here. And then when we get the market right here in Australia, we will work with Cipla to expand our footprints into Europe, the US, China eventually, and other parts of the world. So they are very, very important to us because, as I said, the partnership with Cipla allows us international global access cost effectively, quickly, and efficiently. So that's really exciting stuff for us. And we're well advanced in our plans here in Australia, where we will be launching the Respiri and the Wheezo in October this year. The Australian Patients Association, that again is a very exciting opportunity for us. In Australia, the Australian Patient Association represents about 1.1 million patients. And if you look at the epidemiology, about 12% of those patients will have asthma. So there's about 130,000 patients with asthma that the APA will be endorsing our services and our product to them. So we're really excited about that. That will complement our online strategy, which is really important. Whereas Cipla is much more targeted on where they're very strong, and that's in pharmacy. Now, why is pharmacy so important? Because asthma is very much an engagement that pharmacies have. For example, here in Australia, every month, 1 million patients turn up to a pharmacy with asthma for something, whether that's medication or to buy something. And about 20% of those patients have a discussion with their pharmacist about their asthma. Today, the pharmacist has got very little to provide the patient apart from what they've come in to get, either their inhaled puffer or something like that. With our association with Cipla, we will be giving the pharmacy and pharmacist the tools in Wheezo to be able to help the patient better understand how they can manage their asthma when they're not in the pharmacy or when they're not with their doctors. And this is very important because, as I said today, they don't have anything. So this is a really important part of the strategy moving forward, as is our relationship with the Australian Pharmacy Guild, which is a group that represents the pharmacists of this country. And we've forged a partnership with them to develop an educational program to better skill pharmacists and their staff in the sorts of conversations they should be having with their patients who have asthma, and what they should be saying when it comes to recommending the Wheezo to that patient as a way of improving the way that they manage their condition.
Great, thank you. So could you please tell us, you mentioned that the flagship product is Wheezo. How about like a selling model? What's the profit margin of that, and how make the sellings with the Wheezo, with the pattern of the price? Yeah,
no, that's a very good question. And one of the strategic shifts we made when I took over the organization last year was to create not just a medical device company, but also an e-health SaaS play, software as a service play. So basically the device, we've managed to reduce the COGS, the cost of goods of the device, by 85%. By doing redesigns and things like that, which is bread and butter stuff for an organization like ours and the world-class team I have. So we'll be making between 30 and 40% margin on the sales of Wheezo to Cipla. So we sell to Cipla, Cipla then sells to pharmacy, pharmacy then sells to patient. As for the SaaS subscription fee, that's going to be $8 a month, and that basically is all Respiri's. So we don't share that with anyone. And the beauty of that is, as I said, once we get a patient on board with Wheezo and everything about their asthma is in the one place on their phone, they really will be our patient for life.
Great. This sounds very clear pathway and the selling model of the product. And we know you have joined the company since last year, like in November. You're pretty much like setting up a new board and management team. Mm-hmm. Could you please tell me about yourself, your professional and your industry experience, and how would it come in on your team? And how do you think why do you think the team can bring the company to the success?
Okay. Well, Steph, I don't know too much about many things, to be quite honest with you, but I've been lucky enough to be in healthcare for over 30 years. I started in pharmaceuticals with Merck & Company and Pharmacia, worked in Australia, of course, Europe, the US, spent time in Asia, China included, and some time in Japan. So I've been in this game for a long time. I've worked in pharmaceuticals, I've worked in medical devices, I've worked in service provision. So the last company that I created was a company called Healthy Sleep Solutions, which I started in 2007. Healthy Sleep Solutions went on to become Australia's largest provider of home-based sleep diagnostic and treatment services. I went and presented the concept of the business to the ResMed board in San Diego in the US, and they subsequently became a cornerstone investor in Healthy Sleep Solutions. In a very short period of time, we captured over 40% of the Australian marketplace and became ResMed's largest customer in the Southern Hemisphere and one of their biggest in the world. So the parallels between this and Respiri are fairly similar. So that's my background. The team that I've pulled together is a team that has extensive experience in healthcare, extensive experience in manufacturing, extensive experience in launching new products and building markets, because one of the great things about being first to market is your competition's limited, of course. The issue, of course, is you're going to have to change the behavior of healthcare professionals because they've never had wheezo as a tool for them to manage their asthma. Now, the team that I've pulled together is, as I said, world-class, have an extensive experience in the areas that we want to be good at. And as I've given you a couple of examples, we've managed to reduce our COGS by 85% because we've in-housed that process. We've got the algorithm, which is the proprietary knowledge in the wheezo, to be a lot more sensitive now through this work that we've done. We've developed all these relationships with CIPLA and other bodies because of the people that we know and the relationships we have. So all these things are coming together. And last year when I started with Respiri, I laid out a very simple plan or roadmap to marketplace with all the milestones that I said the team and I would achieve. And so far this year, we have achieved every single thing that we said we would do, either on time or before time and on budget. So I'm very comfortable where we're at. And further testament to this executional excellence dedication we have is even with the horrors of COVID-19, we are still forging ahead and we are still going to meet our October 2020 launch date with everything that we need to make that successful. So that's, I guess, testament to how we operate and the attitudes that the team have.
You haven't mentioned you had a plan when you joined the company. Could you please tell us about what's like short-term or mid-term or long-term?
But the short-term plan was always to make sure that we took the limited resources we have. I mean, when we say limited, I'm not big pharma, but we have resources that we need to focus on those areas that matter. So the short-term plan was to in-house those competencies as an organization that we wanted to have. And that would be strategy, product development, clinical development, and manufacturing oversight. I don't want to have to build an infrastructure of sales reps or anything else like that in Australia or around the globe. So we wanted to make sure that we were good at what we wanted to be good at. We also wanted to make sure there were absolutely no distractions with the business model. We are wholly and solely focused on making Australia a success this year. That's all that matters. And we know that by doing that successfully with our partners here in Australia, we will have the model to then take to other parts of the world and with our partners. And because Australia is a nice market, but not a huge market, it also helps us mitigate risk should we make some mistakes along the way. So we can tack and turn if we need to make sure that we get the model right. And that's the short-term plan thus far. The 2 to 5 year plan, the next stop is Europe and the US. So we will be launching in Europe in Q4 calendar year 2021 and starting in the UK. Well, for obvious reasons, it's an English speaking country, and the US around about the same time, depending on the appetites of our partner CIPLA and ourselves. So we will gauge that success, the success here in Australia, and see how quickly we can leverage Cipla's international footprint, because they have a presence everywhere. So it's not as though we need to start Cipla in the US. They're already there. The only issue is that the market models for the US and Europe will be a little bit different. In the US, for instance, they have CTP codes that are awarded to doctors for providing patients with medical devices to monitor their conditions when they leave the surgery, and they can be up to 100 US a month. So it's a larger portion of the business in the US will be built around those reimbursements from the HMOs, the private health insurers, although there'll still be a large size of business going through the pharmacies. Europe's a little more like Australia, where there's socialised medicine, and some of the larger markets, for instance, Germany, for instance, has socialised medicine, but a similar sort of setup to the US, where, for instance, CPAP machines for sleep apnea, they don't pay for the CPAP machine, but they pay a rental for the CPAP service being given to a patient. And we suspect that wheezo will fall into that same category. And France has a very, very generous reimbursement system. So that's our medium-term plan. Our intention is to grow our portfolio and do that by repurposing our current technologies for other respiratory diseases. And we're currently those are currently underdeveloped, I should say. So we've got a pretty busy 5 years to take on the world. So, but we will be focusing on those markets that comprise up to 70% of the market. If we add Europe and the US together, that's pretty close to 70% of the world marketplace. And that's about 300 million patients with asthma. So a very large proportion. And our business models, we announced in a guidance for revenues a few weeks ago in Australia for somewhere between $6 and $8 million. Now, that basically sees us only penetrate 1% of the total market in this country. So the reason I say that is we're not building a model based on every single patient that has asthma getting wheezo. It's 1 in 100 patients get wheezo. We'll be at about $6 to $8 million at the end of next year.
Yeah, that sounds great for goes to the commercialized way and can generate more revenues. But how they can flex your share price, as we noticed that the share price of the Respiri has gone from 5 cents to 16 cents and back to 5 cents now, about like a 13 to 15 cents, a couple of times already. So why should investors believe it will be different this time and the company will finally deliver the large potential? And in the next 2 years and 5 years, how would you expecting the share price will go?
Just as background, we undertook a capital raise in March this year, $2 million. And we did that in the middle of the big market crash. People called me a lot of not very nice names when we went out there, but we managed to raise the $2 million and some who were oversubscribed. I also made sure that the shareholders who have been long suffering for Respiri, the private shareholders, had the same opportunity at the raise price of 5.5 cents. So we launched SPP, a share purchase plan, and that was wonderfully oversubscribed. We went out for $2 million. We had to cap it at 3.2, and we left about $2 million on the table because we couldn't take it all. And I guess to your question, to me, that was an endorsement from existing shareholders and new shareholders on what they'd seen, what they'd heard, and what we'd achieved to date. So if for your listeners, there is any endorsement they need, our shareholder group has backed management, has backed the new board, and is happy with the direction we're taking. And as I said previously, I don't make a promise that I don't keep. So if we say we're going to do something, we do it. And the share price has responded as we would expect. So we've hit a high of 17 cents from a raised price of 5.5. And our trend is very, very positive indeed. And there's a whole heap of other items that we'll be announcing, some good news in the coming weeks to further support the business that we have and the launch of the product in October this year. So we're very, very confident with what we're doing. And I'm very pleased with the progress that's being made with the launch plan and getting ready to execute that plan.
Great. And how about the company cash position at the moment? You just
We're very lucky. We had in the bank at the end of the year, our financial year, which is June 30, $3.5 million. And we're in a really wonderful position because we have guaranteed orders from Cipla. So we know we've got minimum order quantities from them. So when it comes to financing expansion moving forward, we have more than enough money to launch in Australia. And we have options when it comes to how we might fund further growth in the country and internationally next year. That could be debt funding, that could be order funding, that could be a capital raise. But I guess the beauty of the situation as we find ourselves in now is that we do have options and we're not forced to do anything, which is always a nice position to be. So we're in a very healthy financial situation, under no pressure whatsoever to need cash at this moment. And as I said, when we do, and if we do need the money, we'll be in a position to have a number of options open to us, which is a pretty good place to be.
Thank you. This questions, this discussions is great and impressive. And thank you for discussing with us today about the Respiri Limited, and hope we can see the great growth of the business under the new team and bring value to the existing and potentially new shareholders. And thank you for today very much.
Well, my pleasure. Thank you very much, Steph. And if you need any more information from me, please give me a call.
Thank you.
Okay. Bye.